Right now, a well-known and trusted orthopedic surgeon put on leave in February is reinstated. It is a second chance for a man who was accused of slapping patients on the rear end and saying inappropriate things to them while they were sedated. Our Jim Kenyon has been following this story for us all day long. He joins us live from the hospital tonight. Jim?
Well, Megan, Dr. Michael Clark is considered one of the most prominent orthopedic surgeons in central New York. So it came as a shock last February when St. Joseph's Hospital put him on leave over allegations of inappropriate behavior inside the operating room. Well, today it comes as a shock to many to hear that St. Joseph's has just reinstated him. Earlier this year, operating room staff complained that Dr. Clark slapped sedated patients on the buttocks and made derogatory comments. St. Joseph's suspended Dr. Clark's physician privileges. At the time, he was one of the hospital's most productive orthopedic surgeons. Both the State Health Department and the District Attorney's Office launched investigations. In April, DA Bill Fitzpatrick announced that his office had uncovered evidence of inappropriate behavior, but nothing to warrant a criminal charge. The DA said Dr. Clark claimed that the slaps were intended to determine if patients were fully under the effects of anesthesia. The Health Department review caused the hospital to replace 2 supervisors and revise its code of conduct. Normally, the administration here at St. Joseph's Hospital is more than willing to speak out on just about any issue. But in this case, they've turned down my request for an interview. Instead, they're standing by the contents of this memo which was issued to their staff. The memo explains the decision was based upon Dr. Clark's completion of actions we consider to be conditions for his return, as well as his professional conduct as a surgeon over the last 8 months. And his return is subject to his agreement to adhere to our code of conduct. Outside the hospital, Steve and Martha Moore told me that they think Dr. Clark deserves a second chance.
And I've heard that he's a really good doctor.
Yes.
That his medical expertise isn't in question.
If they improve the oversight in relationship to what's gone on with the doctor and the tools are in place, then I think it's appropriate.
We contacted an assistant for Dr. Clark at Syracuse orthopedic specialists who would pass along our request for comment, but we have not yet received a return call. Reporting live from Syracuse, I'm Jim Kenyon.